Hello, everyone. This is Frederick. On behalf of the Collaborative Care Collective, I am with Dr. Philip Steele, who is one of the presenters. Welcome, Phil.
Hi everyone. It's a
I
beautiful
think,
day here in Helena, Montana. Snow
yeah,
tomorrow.
yes, that's the update. Well, for those who are just joining us, we're at the collaborativecarecollective.com is where you can find information about our next conference. It's June 26th to 28th. And with a dissection on the 29th, a special dissection. It's in Englewood, Colorado. And again, I'm here with Dr. Philip Steele. And Dr. Steele, I'd like you to start with just a short bio, and then I'll start with some questions about what you will be presenting.
I'm a sports medicine doc that started doing regen medicine clear back in 2008, 2009. An early adopter of ultrasound. I'm known nationally and internationally for brachial plexus stuff. I have people travel to Helena, Montana from all over the world to see me about brachial plexus injuries. I've lecture extensively and do workshops with Brad and Tim, but I also do a lot of my own workshops on scapular dyskinesis was kind of the big first area I dived into, and then I'm well known for multifidus lumbar spine, thoracic spine, and cervical spine, and have presented quite a few workshops on the cervical spine and then the suboccipital region, and particularly the nerves and how they function in all these areas. So that's my sort of take on the world. I tend to see a lot of nerve-related problems, brachial plexus issues that everybody else is like, we don't know what to do with this. Go see this guy, crazy guy in Montana.
Hmm. I hear you. Well, that's why I'm really excited to speak with you today about anything really. But tonight we'll focus on what you'll be presenting. And I understand the topic will be with collaborating with Anna Sulia, if that's the proper way to say her name, physical
Hmm.
therapist. And the title of it is Connecting the Knee to the Erector Spinal Musculature, Understanding the Why for Patellofemoral Osteoarthritis. So, what are you excited about this topic to share with Regen Med physicians as well as
Yeah.
other physicians?
This, I had a completely different talk I was working on, and this patient showed up in my office from Bozeman, Montana, who's an avid skier, super athletic, and she showed up to my clinic after seeing an orthopedist who wanted to do bilateral knee replacements on her for severe patellofemoral syndrome. And she was just looking to see if something else was out there and showed up in my clinic, and I did this full evaluation. It was an hour-long eval, and we found all these different areas that I would want to work on. And she said, God, you're the first doctor. I've seen 20 or 30 doctors over my lifetime for a bunch of other issues, and no one has known what to do with this. What do you think of this? And then she shows me this thing that's we're going to talk about, and I was like, oh my God, what is this? And so the this my talk is connecting her patellofemoral to this um, unique physical exam finding that I've never seen on anyone, and she's seen more than 40 doctors and 40 specialists all over the world, and no one could explain this. And this it is why she has patellofemoral bad in both knees, and we're going to connect her spine problem with her knee problem and this unique physical exam finding that we were able to help. Anna has been instrumental in me helping us. We've worked together on this, and hopefully it'll be an interesting presentation. I'll be interested in see what people's initial thought of the what this is. Again, I mean, she's been diagnosed with a thousand things, and no one really knew what to do with this. And so it'll be a unique discussion. It's kind of on the last day, but it's going to be a lot of fun, I think.
I'm already holding my breath. Okay, so there's no spoiler alert here. You're not going to let us
No, I'm
have any
not. I'm not
clues.
spilling the beans at all. It's like I said, when I've shown this video to a lot of different providers, they're like, "Oh my God, I have no idea what that is." And I thought I had an idea about it, and I brought Anna, who lives in Missoula, and I told her about it, and I said, "I want your help with this. I think we could do this as a case presentation, and it's going to rock the world." And so my initial hunch was mostly correct. There's some other areas to add on it, but through bout integrity work with Brad Fullerton and my work with Tim and everybody that I've ever worked with helped create the knowledge base to make the right call on how to make the treatment. This is a classic example of thinking out of the box and going back and thinking about all the different aspects of everything you've ever learned in your career and try to meld them into one patient and say, I hope this works.
Wow. Well, I want you to know, like, for instance, when physicians say you need a knee replacement, right? Did she actually, without spilling the beans, did she actually have chondromalacia patella, like severe, and the knee was just so destroyed that there really seemed like no other option?
Well, she has really very almost no cartilage on the lateral compartment of her patella on both sides, and she has unique injury history. It's interesting that patients just don't tell you the whole story. They only tell you the part that you want. They think you want to hear sometimes, and I think I have a slide that says, who wants more information after you see this a unique physical exam finding. And then you delve into stuff, and then all of a sudden she's like, "Oh, I forgot to tell you about this," and "Oh, back then, and I did this happened," and so the story evolves for quite some time. But literally, I had like 5 minutes left in the appointment when she said, "Oh, I wonder what you think of this," and I was just like, "Oh my God."
So
And so we
listening
brought
to
her
the
back, and I
patient.
called Anna up, and she's been extremely helpful, and Gail will be very proud of her. I'm convinced.
So you collaborated with Anna Sulia, physical therapist. Can you speak on a little bit about that? Because the physicians who wanted her to get a knee replacement, do they collaborate with physical therapists like you
No.
did with Anna to really come
No.
to a team approach with this thing?
Well, she was immediately turned off, because she saw the orthopedist and he just walks in the room, looked at the x-rays and said, "You need a knee replacement." Or, I mean, you could either get your patellas replaced, but then you'll want your knee replaced shortly after that. And so, she was like, "Nah, I'm not quite ready for that." And she just, literally, she just made an appointment to be seen on her knees. And sometimes, knowing, the rest of the story is important. And if she hadn't have showed me that, I don't know that I'd have made this connection to this. I was partway into the story of what was going on with her. I mean, what I had found on her physical exam helped me take a leap of faith and say, I wonder if I can make your physical exam finding extinguish that if I support something. So I'd use pretension that we teach in the last 2 years,
Hmm.
and I supported a couple areas, and I made this unique physical exam finding go away. And she just literally just turned to me and said, "Oh my God, what did you do?" And I'm like, "Oh." And I'm just like, this is even the faculty is going to be like, "What the hell is this?"
What I want to highlight to the listeners is the common answers that people get with something like that. She went to see a multitude of other physicians,
Oh
practitioners,
yeah.
right?
Yeah. For
And
45 years,
obviously,
she's been seeing people over this weird physical exam finding, and no one has literally, she's been told it was all in her head that it's this, and we need to do this, and we have the magic sauce, we'll make it all go away, and nothing's worked, and so she'd literally given up on. And it
but
really
that's
affects her ability to ski when it sometimes when she
sure.
makes a turn, she can't turn to one side well at all. She's a super strong, athletic woman on her right leg, and her left leg just creates this unbelievable physical exam finding. And I
Yeah.
don't know, yeah. And so and it all relates to the spine and all the above. It's connected all the way. I specialize in the brachial plexus. Everything's involved. This is
This
like I said, it was the most unique case in 35 years of medicine. It's a really
well,
cool case.
The way you're talking about the entire body, right? What's above the knee, and of course, what's below, we're going to talk about. But this is not what that one surgeon said. You need a knee replacement. I'm sure the exam, they walk in, they walk out, they look at the x rays, whatever imaging there is, right? And they make a
Yeah,
conclusion without looking at the rest of the body, which has clues, because you picked up
yeah,
on clues about
yeah.
what could be really be the cause and not
Well,
just
the
the symptom.
radiologist, I mean, the orthopedist walked in the room, looked at the X-ray, didn't touch her, and just said, "Do you need knee replacements?" He didn't actually touch her, and
That's standard of
so,
care. That's standard of care today.
well, I mean, for an orthopedist that looks at film studies that say you have horrible arthritis, I can, I can cure that. I can cut it out and put a new knee in. So, I mean, for him, he did what he knew how to do.
Hmm. Hmm.
And what's unique about Collaborative Care Collective is learning there's it's from foot to head. I mean, it really is. You got to look at the whole system. And my chagrin is that I stopped looking at her from the pelvis down to her feet. I examined everything from her pelvis down before I even touched her knees. I didn't even look at her knees. I looked at those last.
Hmm.
That's kind of my typical practice is look at everything else first. Don't look at what they're complaining of first, because then you won't get, that's as far as you go. And so, I felt like I'd spend an hour with her examining her feet, her legs, her knee, her hips, her pelvis. I mean, there's a huge, every physical therapist knows that patellofemoral can start through the pelvis. I mean,
Well,
and so, I mean, that's a key part of it, and it's part of
right.
the challenge that we all face is, do you have enough time? I'm lucky I can, I own my own practice, so I can schedule my patients how I want. I schedule an hour physical exam, and then we'd have a discussion about what's the best plan of care.
Well, obviously, physicians that are regen med or any physician could really benefit from what you're going to speak on with this case study. It sounds quite amazing. What about physical therapists? That sounds like with Anna co-presenting with you, physical therapists and other people like strength and movement therapists, maybe even body workers. What do you think they would benefit from this presentation? Like what Anna would say, I guess.
Well, obviously, I have limited resources in Helena, Montana. I mean, and this collaborative care collective is learning to build friendships and find people to work with. And it's like I met Anna, and she at a collaborative care collective, and I didn't know her, and we now share a lot of patients together, and so that's the collaborative component. And it's networking with smart people. I mean, I networked with you, Chris, on a couple of my patients. I've networked with Diane Lee. I networked with Gail. I networked with Tim. I networked with Brad. And you're only as strong as no matter how good you are, you're only as good as your staff, and you're only as good as your peer group. And surrounding yourself with a really strong peer group that you can collaborate with is really important. And I think we all sort of, pound our chest and look at all these great courses I went to, but in reality, we need to know when to stop and say, I need to ask them for more information. And sometimes body workers know something that I don't. They can feel something. There's a tissue problem or whatever. And I wish I had that ability. I wish I had that network here in Montana. I mean, I usually have to go outside of it, but I mean, if I had Chris, oh my God, if I had you next door to me, I'd be using you all the time. So that's what's important about this conference is not just hearing the lectures, but I think the breakouts when you talk to other people, it's like, well, where are you from and what do you do? And oh wow, I have a patient from there. I would like to refer to you. Yeah, and so that's what collaborative care is all
It is, that
about.
is the theme. And it's amazing that you met someone in Montana, not maybe in the same city, Missoula versus Helena, right? But that's
Hmm.
incredible. You met someone at the conference, and this is what can happen to any of you who are listening. Incredible things do happen at this conference because it is a collaborative event where people from physicians to physical therapists to occupy all kinds of therapists, as well as the strength and movement people are working together to try to just understand the patient's story
Mhm.
and the patient.
Mhm.
Lastly, when is it appropriate for a non-physician to consider referring to you?
Well, I mean, I have a lot of physical therapists refer to me all the time, although I am, but
Can you repeat that last part that,
the
that got cut out? Could you repeat that last part?
I'm retiring. Yeah, I'm retiring here soon, Chris. Yeah,
Oh,
not. We could talk after you're done videoing, but for referral to Tim or Brad or anybody, I think there's a lot of patients out there. I mean, I see so many people with whiplash associated disorder, chronic headaches, chronic neck pain. Everybody has the special sauce. They're all searching for someone that can help them, and I see people from all over the United States for that. And and there is no one thing that's going to solve this. I always use the analogy to my patients. So like, a lot of these people, are told they have ligamentous instability, the cranial cervical junction, and I'm like, yeah, but those ligaments are really teeny. They're not that big, and there's this huge network of all these muscles and tendons and ligaments all around the neck that are just as important, and nobody looks at that. And I
hmm
go,
hmm
and so I'm like, I want to fix the system before we focus on one little tiny, alar ligament or transverse
hmm
ligament. Yes, it looks slightly abnormal, but on MRI, we know that the human form is so variable. No MRI is 100% in telling you it's torn or not torn. And I said, let's not focus on that. Let's focus on the things that we can solve easily, fix the big picture. So I use this as an example. I saw a patient that was actually a patient referred to me from Colorado who had a congenital, the lamina of C2 on the left never closed. And so her spinous process on C2 on the left was displaced and off and not connected.
hmm
And she'd been treated by I don't know how many people. She'd had a lot of the procedure for the cranial cervical instability. She'd had 3 rounds of that. She had lots of different procedures, lots of things, Prolo, PRP. Everybody's done something, and even the radiologist never ever. She's had multiple MRIs, multiple CTs. They never commented on the fact that her lamina C2 on the left was not working down the wrong path. Everybody's going in the wrong direction. They're all doing the wrong thing because what attaches to the spinous process of the bifid component of the spinous process? Well, on the left, you have rectus capitis major, you have inferior oblique, you have a semispinal cervicus, and you have a bunch of other smaller interspinous ligaments,
hmm
but they all attach there. It's unstable. And everybody that's ever examined her was focused on her right, because that's where she feels all the symptoms, is on
hmm
the right. They always say that I'm overlapped on the right. And everybody's like focused on that. And I'm like, well, yeah, because there's nothing on the left side that's holding it in place. And
hmm
so,
hmm
we changed the paradigm and said, oh, this is unstable from a completely different set of reasons. And
hmm
so I'm not bashing anybody or saying anybody. What happens is
hmm
is everybody's assumed that because the radiologist didn't mention, despite CTs, multiple MRIs, no radiologist mentioned this. They all went down the same path. They all went down,
hmm
oh, the right side's the problem. That's what she hurts. That's where she's having problems. Well, that's not the problem. The problem is the left side. Um, you know, Showing an image, a unique case, presenting that unique case. I mean, I present this at a million conferences. I needle on that spinous process and stabilize the whole left side of her neck. It's not attached to anything. And so, that's to me, that's what these conferences about is learning who you can ask these questions to. Hey, I have this weird MRI. What do you think of this?
Mhm.
This is a physical exam finding. I don't know what to do with this. There's always somebody out there that'll have an idea. And to me, that's really the case here. And hopefully when you refer, you learn those referral networks at a conference like this. And it's like I refer people to other doctors and hopefully and they refer to me and I always sort of say that I've seen so many people and they've lost faith in the system. And
Mhm.
I think what Collaborative Care Collective is all about is regaining faith in the system
Mhm.
that by communication and collaboration, we can solve problems that aren't solvable by a provider alone.
Excellent. Well, I think we'll end on that note. Very inspiring. I can't wait to hear your presentation. And I invite everyone listening to come to the collaborativecarecollective.com if you want to go and register, read all the information, the descriptions of what we're doing. June 26th, it starts, 2026 in Englewood, Colorado. Come one, come all. We invite you. Thank you, Dr. Steele. And to all a good night.